Assalamualaikum and hi. My name is Redani Zawawi and my research title for 18th Student Scientific Conference is Does the urethane dimethacrylate, Udma, improve the properties of dental-based composite resin? And this research was supervised by Associate Professor Dr. Dasmawati Muhammad. Going straight to the introduction part, as all of we know that the main compositions of resin composite are resin monomer, silane coated glass fillers, initiator and coupling agent. Traditionally, the most common resin used in dental-based composite resin are mixture of BCMA and TECMA only. However, lack of adequate strength and toughness in this mixture has led to research that is aimed at improving the mechanical properties of dental composite. Over the time, there are many high molecular weight monomers developed and introduced in commercial materials to overcome the limitation of BCMA-based systems. And nowadays, additions of new resins, specifically Udma, became increasingly common due to these monomers' low viscosity and high flexibility in relation to BCMA. Figure 1 shows chemical structure of Udma. Udma have strong hydrogen bonds formed by the urethane proton donor group, which cause a further increase in mechanical properties of the composite. And due to the presence of urethane group, Udma molecule is more flexible than the BCMA. The problem statements for this research is, does the incorporations of Udma improve the properties of dental-based composite resin? Whether yes or no, I will eventually reveal it at the end of this presentation. Next, the general objective for this research is to review on incorporations of Udma as a resin-based composite by evaluating the mechanical properties, specifically on flexural strength and hardness. And this research hypothesized that resin-based composite with incorporations of Udma have a higher mechanical properties compared with incorporations of other resin. Moving on to the materials and method used for study design, overview of literature synthesizing the findings of literature retrieved from scratches of computerized database and authoritative text from a reliable source of journals such as PubMed, Science Direct, Web of Science, and Scopus. And the keyword used are composite resin, Udma, mechanical properties, flexural strength, and hardness. For sampling method, the data search ranging from year 2000 to 2020 were obtained from available online research articles based on the keyword that I mentioned earlier. And then, among hundreds of articles related to the incorporations of Udma in the dental-based composite resin, there are 12 relevant articles from 2006 to 2020 has been extracted, and constant comparative analysis of research article was done. Then, the summary of the result was listed to show the evidence where the incorporations of Udma improve the mechanical properties of the composite resin. For sampling criteria, inclusion criteria are data from reliable sources such as PubMed, Science Direct, Web of Science, Scopus, etc. And exclusion criteria are data from unknown sources such as Wikipedia. The highlight of these presentations, of course, the results and discussion part, where I divided it specifically by two main mechanical properties of dental-based composite resin, which are flexural strength and hardness. For flexural strength, the latest relevant article, which is in 2020 done by Isabella, presented the incorporations of Udma in dental composite containing BCMA and TECMA in the ratio of 40 to 20 to 40, stated the highest flexural strength. Next, in 2016, Nick J. Waters found that the composite containing Udma had significantly higher strength than those containing BCMA. Apart from that, there's also evidence of composite containing Udma and TECMA in the ratio of 60 to 40 weight per have highest flexural strength as compared to combinations of other monomers through research by Laura in 2014. Other than that, based on research by Letitia in 2013, it shows that composite resin containing Udma, which is in this research they use Filtec Supreme and Filtec Z250, have higher flexural strength. However, Filtec Z250 have a bigger filler size than the Filtec Supreme. Therefore, Filtec Z250 have higher flexural strength than the Filtec Supreme. Gajewski also found that incorporations of Udma as monomer in dental composite show highest flexural strength as compared to others monomer through his research in 2012. Moving on to the next one, Jin also found in 2012 that dental composite with 100% of Udma as monomer has the highest value of flexural strength as compared to dental composite with combinations of 2/3 Udma and 1/3 Tegma. In 2009, Carmen also found that dental composite with the incorporations of Udma have the higher flexural strength, and it is statistically different with the dental composite with no incorporations of Udma. Next, Yuji Zhang also presented the incorporations of Udma 3.75% in combination of BCMA 17.25% and Tegma 3.75% increases the flexural strength. Last but not least, there are also evidence in 2006 that dental composite with BCMA, Udma, and Tegma presented a higher flexural strength than combinations of BCMA and Tegma only. Next, regarding results related to the hardness. In 2020, Isabella found that the combination of BCMA, Udma, and Tegma in the ratio of 40 to 20 to 40 shows higher value of hardness as compared to combination of BCMA and Tegma only in the ratio of 60 to 40. Other than that, in the research by Rin in 2015, it shows that incorporations of Udma together with BCMA and Tegma in dental-based composite resin show highest value of hardness. And last but not least, the incorporations of Udma in Filtec Supreme Plus increase the hardness of the nanodental composite, and this research was done by Nicolita in 2011. Therefore, based on all relevant articles retrieved, I can conclude that the incorporations of Udma in resin composites improve the mechanical properties specifically on flexural strength and hardness of dental-based composite resin. However, there are a long way to go and more research need to be done in our journey of finding an absolute ideal composite resin as restorative material to fulfill the demands of both dentists as operator and the patient itself in this new era of technology. That's all from me. Special thanks to my supervisor, Associate Professor Dr. Dasmawati Muhammad, for her guidance throughout the journey of these review articles. And also appreciation goes to those who directly and indirectly involved in these review articles. This is my list of references, and that's all. Thank you.